I'm going to be a nursing student. This is Jeremy, who's going to play my nursing instructor. And this is Jeff, he's our patient. For any nursing skill, you want to perform the 10 mandatory elements. The first one being you want to check the physician's prescription. The second, you would like to wash your hands before and after any procedure and assemble equipment. The third, you want to identify the client by checking the armband and the bed tag and by asking the client to state his or her name. The fourth is to introduce yourself to the client. The fifth is to provide privacy needs and confidentiality. The sixth is to explain the procedure to the client using developmental appropriate language and techniques. The seventh is use standard and universal precautions at all time. The eighth rule is to use proper body mechanics at all times. The ninth is to refer to the textbook and skills checklist to accompany textbooks for the steps and skills that we are required to perform. And the 10th is if any abnormal responses are noted, notify your instructor and the staff nurse assigned to the client, as well as document the skill and client response. Starting off, we're going to do the 12 cranial nerve assessment, and we're going to do the first one, which is your olfactory nerve. So I'm going to have you close your eyes. I'm going to place something beneath your nose, and I would like you to tell me what it is I'm holding beneath your nose.
It smells like a lemon.
Alright, great. That nerve is intact because he was able to correctly state what it was I was holding beneath his nose. The second nerve is his optic nerve, and we could test that by having him determine what he can see. So we have a Snellen chart. Across the way, I'm going to have him close his right eye and view with his left, and I would like you to read the fifth line for me.
PECFD.
Great job. I'd like you to close your other eye and do the same thing.
PECFD.
Alright, great. That nerve is also intact. We're going to test nerves 3, 4, and 6, which is his ocular motor, his trochlear, and his abducens nerve. To test that, we could have him look in all different directions to make sure his nerves are able to accommodate in all different directions. Alright, great job. Specifically testing the third nerve, which is the ocular motor, we could test if his eyes are able to accommodate to light and accommodate to distance. So I'm going to start back here, and his pupils are dilated, and I'm going to bring it closer, and his pupils are constricting. That's great. Okay, so that nerve is definitely intact also. Okay, I'm going to test his fifth nerve, which is his trigeminal. I'm going to have you close your eyes, and I'm going to place this pin on one side of your face, and I'd like you to tell me which side of the face I'm touching. Good. Good. Alright, great. That nerve is also intact. We're going to check his facial nerve. We could do that by having him make facial expressions. Can you please puff your cheeks up for me? Alright, great. We could also test his facial nerve by having him do a taste test and determine whether or not he could distinguish taste from one another. So I'm going to put some substance on this for you, and I'd like you to place this in your mouth and tell me if that's sweet or salty.
Sweet.
Alright, great. That was sugar, so he was correctly able to identify what this substance was. Our next nerve we're going to test is his eighth nerve, which is the acoustic nerve. So I'm going to have you close your eyes again, and I'm going to make a sound on one side of your ear, and I'd like you to tell me which side of your ear you hear. Good. Good, one more. Alright, great. That was the eighth nerve. For the ninth and 10th, which is our glossopharyngeal and our vagus nerve, we could test that by checking his gag reflex. So I'd like you to open your mouth and stick your tongue out. Open up wider, please. Good. Alright, great. His gag reflex is intact, so that's definitely important. His next nerve is his 11th nerve, which is his accessory nerve. I'd like you to keep your hands by your side and shrug your shoulders for me. Alright, great job. That nerve is also intact. And his last nerve, which is his 12th nerve, this is hypoglossal. I'd like you to stick your tongue out and move your tongue in the upward direction. Great. your chin, left, and right. Alright, great. That concludes an assessment of the 12 cranial nerves, and
I'll just to make sure that you got it all, I'll ask you a couple of questions to see if you know it all the way.
okay.
What nerves test for the gag reflex?
The gag reflex is the 9th and 10th, the glossopharyngeal and the vagus.
Okay, that's good. And the olfactory nerve assesses for what?
The olfactory nerve we could use to assess for smell.
Oh, okay, great, you got it. And how's the facial nerve assessed?
The facial nerve is assessed by how I'm having him make facial expressions, or we could assess it by having him do a taste test also.
Okay, wonderful job, Kevin.